65-year-old female. Incidental finding during investigation for headache of a ruptured intracranial aneurysm. Neural examination was normal. This is the angiography of our patient. This is AP view on the left and lateral view on the right. We can see that there is an aneurysm arising from the ophthalmic segment of the supraclinoid internal carotid artery. What is the meaning of pointing upwards? Pointing upwards means the aneurysm is located under the optic nerve? No, because as we remember, carotid artery, the supraclinoid segment of the carotid artery, is located lateral and below the optic nerve. If the aneurysm is pointing upwards, it is in a small aneurysm like this, probably it is not under, it is not below, it's not located below the optic nerve. But if the aneurysm is pointing upwards, it may be a little bit laterally. So what is the structure the aneurysm will be attached to? We have to be careful because lateral to the exiting site of the supraclinoid internal carotid artery is the anterior clinoid process. These are the oblique views of her angiography. 3D reconstruction of her angiography. And the neck is about 3.9 millimeters and the height of the aneurysm is about 3.3 millimeters. So she underwent a right Teriona approach with the exposure of the ICA over the neck. So we have the proximal control of the internal carotid artery in the neck. And then at this stage of the surgery, the Sylvian fissure has already been opened. So let's go to the movie. So here we have the right optic nerve, right carotid artery. I don't see the aneurysms in this area. It's hidden by the anterior clinoid process. So I have to remove the anterior clinoid process in order to clip the aneurysm. I can actually see a little bit of aneurysm over here. But the great majority of the aneurysm is covered by the anterior clinoid process. So very careful. Now I'm cutting the dura that covers the anterior clinoid process. I'm doing the drilling of the anterior clinoid process intradurally. So I have to remove this part of the bone using a diamond bit, 2 millimeters. You have to unroof the optic canal. So you can see where the optic nerve is located, and also you can mobilize the optic nerve if necessary. And this is optic nerve, and this is anterior clinoid process. I like to drill first the core, the center of the anterior clinoid process, and then go to the to remove the shell, the remaining shell. So sometimes it can be very stuck. You have to dissect, sometimes to cut, and then remove it. As long as you don't damage the carotid oculomotor membrane, it will not bleed. You will not open the capital sinus. But sometimes fibrin glue is very helpful, very useful to stop the bleeding. In the old times, we always use Surgicel. It takes much longer time to stop bleeding from the capital sinus. The next step is to cut the optic nerve sheath longitudinally along, along the optic nerve. Be careful not to cut the ophthalmic artery. So I'm checking to see the medial superior part of the carotid artery to see where the ophthalmic artery is located. I didn't see anything. It's not there. And then now I'm opening and cutting the distal dural ring. You'll see the aneurysms here. The aneurysm is covered by the dura. So I'm using this layer of dura as extra protection for not rupturing the aneurysm. Now continue to cut the dural ring. So I'm exposing better the aneurysm, exposing the proximal, the normal part of a ICA proximal to the aneurysm. Continuing to cut the dural ring. At this part I opened the carotid oculomotor membrane, but I have injected fibrin glue, so it is not bleeding anymore. So cutting more dural ring around the aneurysm. So this, on angiography, this aneurysm is pointing upwards and maybe a little bit laterally, so it is under the anteroclinoid process. Continuing to cut the dural ring to free the aneurysm, so it will accept better the clip. If you leave a bunch of dura, might interfere with the closure of the clip. So I chose this one. I was measuring the length of the shank of the clip to close it. So after the removal of the anteroclinoid process, the surgery became much easier. And this is a final aspect after the clipping. She remained neurologically intact after the surgery. And this is her postoperative angiography. The AP view on the right, and here is the lateral view, and this one is just to show the clip.